so that we can make the recording available on our website and on our YouTube channel at a later date for anyone who might have missed it or anyone who wants to revisit it. I'm just going to go over quickly how this platform WebEx Webinars works so that we're all familiar with its functionality and can enjoy the session. So first, you can turn on closed captioning by clicking the closed caption button at the bottom left-hand corner of your screen, if you want to do that. You can also change what you're looking at or the layout by clicking the layout button at the top right-hand corner of your screen. You can raise your hand or do a thumbs up by clicking either the hand or the smiley face buttons at the bottom center of your screen. But please note that in this platform, you can't unmute yourself. But if during our question and answer period, you have a question that you prefer to speak out loud, you can raise your hand and I can unmute you. And finally, you can access the chat at the bottom right-hand corner of your screen. And I'll be keeping my eye on the chat throughout the session. And as I said, there will also be an opportunity to ask questions at the end of the session. But with that, I'm going to stop sharing and I'll turn it over to our speakers.
Thanks, Chelsea. So welcome, everybody. Thanks for the introduction. And we'll just jump right into the presentation then. So thank you also, Chelsea, for your land acknowledgement. I'd just like to also acknowledge that the University, the Alberta Sports Support Unit and the PaCER Patient and Research Engagement Training Program is offered through the University of Calgary, which is based on the homeland of the people of the Treaty 7 region in southern Alberta. So welcome, everyone. When Chelsea and Holly first approached us and asked us to speak about patient-led, patient-initiated, patient-driven research, PaCER immediately came to mind because basically the research that PaCER produces really encompasses all of these aspects. But when I started to think about who to invite to join this conversation and suggestions about what they could share, I really started to realize how unique and dynamic each patient researcher journey is. And also really that PaCER might be the beginning of some patient research partners' journey. PaCER might be something that patient partners access partway through their journey, and some patient research partners might not engage in the PaCER program at all. So what we'd really like to do is share a bit about the PaCER program, but also we have these 4 patient research partners with us today, and we'd like them to share their reflections, their stories, some inspiration and ideas about where to go and where they went to find support, resources, and learning opportunities to help them grow as a patient research partner. So many of you are probably familiar with the Canadian Institutes of Health Research, one of the major funding bodies for public health research in Canada. And in 2014, they launched their strategy for patient-oriented research, SPORE. And as part of that strategy, they established SPORE support units in 11 of the provinces and territories across Canada with the aim to support researchers and patient research partners to work collaboratively on health research projects. So we're part of the Alberta SPORE Support Unit, ABSPORE-U, which has 4 teams, and I'm part of the patient engagement team. So CIHR strategy for patient-oriented research asked that patients and communities were involved as active and equal research partners on as many aspects of the health research cycle as possible. They asked that patient partners are engaged early, often, and at all stages, and that training and supports are offered so the engagement is equitable and meaningful. So this is just an example of the CIHR health research cycle. We've added in some other places where patient research partners or other activities patient research partners have been asked to engage in. So PaCER is one way of gaining skills and experience to be a patient research partner. PaCER is a 12-month online certificate-based program. It's delivered through the University of Calgary Continuing Education in partnership with the Alberta Sports Support Unit Patient Engagement Team. Teams of 5 to 7 diverse members are sponsored by health service organizations, clinician and academic researchers, and sometimes patient or community organizations. So PaCER essentially teaches qualitative participatory health research skills and experience to patient and community members, and then they design, develop, and carry out a full qualitative research project about a health topic that matters to them and to their sponsors. This is just the PaCER website, and if you're interested in learning more about some of the PaCER projects or some of the PaCER publications, there's a little tab here, research, that would be helpful to learning more. So PaCER is delivered in 3 courses. It's delivered online over 12 months. Course 1 really focuses on building the team as well as gaining some basic qualitative research skills, literature reviews, ethics, data collection. PaCER uses interviews and focus groups, as well as thematic and narrative analysis. In course 2, the teams take up their broad research topic, hone it down to a very specific research question, which they then design a protocol to answer that question. And that protocol gets submitted to the Research Ethics Board at the end of course 2. There's a little bit of a break while we wait for ethics approval. And then in course 3, the teams actually carry out their project, finishing up with a final report. And just put the slide in here because Nancy Marlette was the founder of the PaCER program, and Gray Matters is the textbook that she developed for this. It's available online, and while some of it is a bit dated, it still is a really good read. So I just wanted to acknowledge Nancy in this presentation. And this is just a list of some of the sponsors. So the PaCER teams do need a sponsor, so the program itself is free. You do have to make a year commitment, but you also need to have a sponsor. And while the PaCER team members all share a similar lived experience of the same health condition, they come from very different backgrounds. And that's important in the PaCER program because PaCER is about learning about perspectives additional to your own. So the teams are quite diverse. People come with different educational, economic, professional, geographical, and other backgrounds to the PaCER program. And PaCER projects are usually not one and done. Many of the teams go on to publish. They share their work at conferences. Exciting now is that many of the projects are going on into second phases and iterations, and you'll learn more about that shortly. So I'm going to turn over to Maria. And Maria, if you're okay, just let me know when you would like me to move the slides forward.
Okay, perfect. Thank you, Ingrid. So good morning, everyone. Thank you for being here. And thank you, Ingrid, for inviting me to share my experience. Please go next. I am currently working for the Vaccines in Pregnancy Canada team at the University of Calgary. And I would like to dedicate this presentation to the Complex Care Hub at South Hill Campus and the community paramedics team that took care of me and my babies while I was dealing with hyperemesis gravidarum during my pregnancies. I never imagined that struggling during my pregnancies was going to take me to this place, but everything happens for a reason. So how I end up doing this? Well, I have been working on community engagement for a while now. I have a professional background in psychology, and I worked with promoting behavioral changes through community engagement back home. So those are the 2 first pictures there in remote areas of my home country, Colombia. Then I got some lived experience of 2 very rough pregnancies that happily ended in having these 2 beautiful kids. And that's how I ended here, because the combination of that professional background and my lived experience brought me into PaCER to get some training on how to use my experience to help others and to improve their lives and their maternal care. So I landed in the Repro ID team at the University of Calgary, and I would like to share just a piece of what we are currently doing. Next, please. So what we want is to improve the quality and frequency of vaccine communications in pregnancy, because there are a lot of struggles with vaccination during gestation, and we found that most of it is because we are not having that conversation. So what we want with our research is to empower patients with tools to make informed decisions and actively participate in shared decision making. But we also want to touch base with providers and enhance their skills to actually have those conversations. So to do that, next, please. We have designed, and we are actually working on the co-design of an intervention for patients and providers. And the basis of our work is patient-oriented research. So we are involving patients in our work in every single stage, starting for having 2 patient partners in the core research team, which is my manager, which is also a PaCER graduate, and me, that I am the research coordinator. But we also have a parent-partner research and advisory council. They identify priorities, participate in knowledge translation and community engagement to ensure that our practices, research, and overall work are patient-centered. We have parents with lived experience that represents diverse populations and perspective, and that's the way in which we bring their voices to our work. Plus, we also use patient-oriented research methods through focus groups and interviews to understand parental preferences and test knowledge materials with the community. And the most important for me is that we also do community outreach. So at the end of all these processes, we get back to the community and, well, help them to understand and bring them back our tools. Next, please. So this is a sample of what we have been doing and the result of our work. We currently co-designed a website that is called Vaccines in Pregnancy Canada. Next, please. And we have 2 things. We have a patient-facing website that have been co-designed with patients. We have testimonials. We have knowledge translation materials such as infographics that they can easily download and get ready to have that conversation with their providers. But we also design a course for providers to enhance their skills and get them ready to have this conversation and approach these controversial topics with their patients that are actually willing to have the conversation, just finding opportunities to do so. So next, please. So this is just a piece of what we are doing, but we are all humans. We all have experiences and we all have a voice. So my invitation here is that we use that voice and those experiences not only to advocate for us, but to make a difference for others. And that's what PaCER brought into my backpack, and I really appreciate enhancing this work every day, because I really feel that we are making a difference, bringing patients to the healthcare system. Thank you.
Thank you, Maria. So we'll move on to Kim. Kim, are you able to? I can't see.
Sorry. Hi, I'm Kim Giroux, and I'm currently joining you from Calgary. I was a PaCER student quite recently. I graduated in December of 2022. This is the poster from my PaCER project. It's way too small to be useful. And I'm not going to spend a lot of time talking about the project anyway. I've chosen instead to do what I think patient partners do best, and that is to tell my story. So I did graduate in December of 22. Alberta Health Services sponsored my team's research question, which was, what matters most to patients returning to rural Alberta after a hospital stay? And I'm pleased to say that this was not just an academic exercise. We continue to build our skills through knowledge, translation, and engagement, including things like doing presentations at national conferences. We did make up this poster, which gives us much more opportunity to share our work through poster presentations. And we can continue to consult with Alberta Health Services on related initiatives in this area. We're also in the early stages of developing a manuscript for publication in a medical journal. Now, Ingrid mentioned the PaCER program generally has people in teams with similar lived experience. That was not my experience with PaCER. I do not have this lived experience at all. I am a city girl through and through. My family are city people. I have very little knowledge or understanding of rural Alberta. But I take my role as a champion for this area very, very seriously. We had the most amazing patient partners in our study, and I try to represent them and our findings in all of the work that I do, whether I'm presenting this project or working in other areas. So PaCER gave me the skills and confidence to contribute so much more than I was previously, not only to research projects, but to all of the patient work that I do. It has moved me from a patient advisor to a true patient partner. Though certainly my opportunities to be included in exciting research projects has increased. And some of these projects include, this is a mouthful, the repurposing, the ordering of routine laboratory tests in hospitalized medical patients. So we just call that report. I'm a co-chair for the Patient Advisory Council with that group. I also co-lead the patient team with the Rheumatology Learning Health Center. I'm a co-chair for the Equitable Person-Centered Health Measurement Patient and Family Community Advisor Council. And I just returned back from Montreal for the Choosing Wisely Canada conference, where I was representing the de-implementation of low-value testing. But not all of the projects I work on are research related. I continue to be a patient participant and an advisor in various capacities. And some of these are the strategic clinical networks for Alberta Health Services. I sit on the community advisory board for artificial intelligence for public health. I am part of SPORE's Implementation Science Collaborative, and I sit on the Map to Motion board with the Alberta Bone and Joint Health Institute. Each of these offers different opportunities for involvement, from conducting research to facilitation, giving input into projects and initiatives, all the way to building knowledge translation tools. Before and during my PaCER studies, I would grab every opportunity that came my way, anything that I met the criteria for. I just felt grateful for the opportunity to be included. I've moved on from there, and now I'm able to make more selective decisions. I'm now mostly involved in areas of particular interest and relevance to me, and many of the projects I'm involved with have become interrelated issues and themes, and I'm able to build on and share learnings across them. I feel like I'm really finding my niche. PaCER and my lived experience have given me a lot of knowledge, but I also come with a prior skill set. I had a whole career before any of this happened. I'm not a patient or a patient partner in isolation of all my other lived experiences. I have those past careers. I volunteer with a lot of organizations. I have hobbies and I have interests. Many of my skill sets from other parts of my life are transferable to the research team. Just like with all of the other research team members, it all contributes to my journey as a researcher. Every patient brings different skills to the table, but we also bring different needs, and these often include managing chronic health challenges. I no longer grab any project that comes my way, feeling grateful to be accepted. I now look for the projects and roles that fit with my interests, needs, and aspirations. Some opportunities are more rewarding than others, and I feel like the best ones include open and honest communication around these interests and needs and aspirations, as well as those of the team. I am lucky to be involved, but they are also really lucky to have me at the table. The ultimate validation for my contributions has come when researchers who I've worked with before have reached out to me to work with them again on future projects. Because of this, I'm now involved with projects right from the grant application stage. I find this really rewarding as it allows me to give even greater level of contribution and understanding. I've only been a patient partner for a couple of years now, but I've come a long way in a short time, and I really look forward to continuing to learn and grow using the skills that I have and learning new ones along the way. Thank you.
Thank you, Kim. And then next, Sherry will share her story.
Great. Thanks, Ingrid. I hope everybody can hear me. As Ingrid said, my name is Sherry Vera, and I'm coming to you live from beautiful Beaumont, Alberta, just outside of Edmonton, Alberta. I am retired from paid work life, and I'm a proud grandmother to 4 granddaughters. I have lots of lived experience with our healthcare system, both as a patient and a family member. I want to share with you how I've chosen to take my passion for wanting to make sure that the voice of patients and families is heard at all levels of the healthcare system. I retired in March 2018 from a career in Alberta Health Services in administration supporting healthcare leaders. My last role was supporting leaders and education programs in quality healthcare improvement. I was enthusiastic about patient safety and patient engagement, and I really wanted to continue to be part of this sphere of work in my retirement. I became a patient advisor in Alberta Health Services in the fall of 2019, and I've joined various patient advocacy groups and participated in focus groups and quality health improvement projects. Most recently, I was part of a national conversation with the CMA to talk about public and private healthcare and delivery. In our province here, I actually was just part of a pretty large initiative spearheaded by a group called Imagine Citizens to provide our provincial government feedback and a very detailed report on refocusing our healthcare system, which is an initiative that this government has taken on. So was pleased to be part of that, and was lucky to be sponsored by the Alberta Sport Team to attend a seniors health conference in, I think, 2019 as well. So had lots of different experiences, and like Kim, I've been looking for those opportunities to serve on boards, but those places where I would have the ability to have a voice, not just be a token patient advisor sitting on a team, attending a bunch of working group meetings and not ever actually being asked or offered an opportunity to contribute. In June 2018, I was sponsored to the PaCER program. It actually came as a result of one of those healthcare leaders who was also a researcher said, I've learned about this program, and Sherry, you're just a perfect fit for this. You need to go and try it out. So I did get sponsored, and my cohort was sponsored by the Kidney Health Strategic Clinical Network. And although I didn't suffer from chronic kidney disease, I had a kidney cancer removed. But as Kim said, it wasn't really about my lived experience. It was the opportunity to gain all those valuable skills to become an active patient partner and a patient researcher. Our cohort was probably one of the, I think it was the last cohort where we actually had some face-to-face meetings as teams. So we were able to meet a couple of times face-to-face at the University of Calgary and get to know and bond as a team, and also get some mentoring from various people to work on the refining of our topic and developing of our protocol. I want to make a special mention of the amazing sponsorship and commitment that our provincial health organization, Alberta Health Services, has given to train up literally, I think at this point, hundreds of patient and community engagement researchers. So Tracy Wazalak, Louise Morin, these are huge champions from within Alberta Health Services who not only believed in the power of patient partners in research, but also put their money where their mouth was. So they sponsored us, and I'm eternally grateful to them. Our cohort was primarily a virtual experience, but we also were probably one of the last to actually do face-to-face focus groups. That was a novel idea. So everything's virtual now, but that was pretty interesting. As Kim said, our capstone was published, and I'm going to attempt to pop that in the chat. So our project was called Unplugging While Plugged In, a peer-to-peer exploration of the impacts of dialysis on the mental wellness of patients with chronic kidney disease. And so yeah, that's where I got my start. Next slide. So once I was a graduate, I looked for all those opportunities to try and use that skill set, and also to help people understand that bigger skill set that I came with. So not only my background from my work life, previous work life, and my various lived experiences with the healthcare system, but also my newfound skill set as a PaCER. One of the opportunities that presented itself as I was became a patient advisor on as part of the Medicine SCN Strategic Clinical Network. And I know we keep talking about these SCNs, and for those of you that don't come from Alberta, you probably have no idea what they are, but essentially it's a large, vibrant group of doctors, researchers, other healthcare professionals, and a lot of patient partners looking at very specific ways of doing projects to help improve the healthcare system. And they're divided up into areas of sort of focus, I guess. So as a brand new member of the hospitalist section of the medicine SCN, and partly as a result of my work with PaCER, we were offered, everybody on the team was offered the opportunity to present an idea that could potentially become a project that would align with the brand new strategic directives of this Medicine SCN, or Strategic Clinical Network. And I had 4 patient advisors on the hospitalist section with me, and we decided to try and develop a proposal that would address the specific strategic direction, which was empowering patients to improve their experience and health outcomes. And we thought, well, we're definitely the team that should put together a proposal on this. We had lots of support from some AHS staff members who are assigned specifically to work with patient advisors and make sure that they feel included and that their work is valued, and give us any assistance we need. To that end, they actually were able to provide us with some data from within AHS on patient-reported outcomes and on patient satisfaction data, and in particular, for those that have been hospitalized. That gave us another glimpse at to what the problem might be, or something that we could do, a specific question that we could try and get a handle on. And as we started refining that idea, it evolved from sort of patient self-advocacy into a first iteration of the idea, which was patients actively partnering in their own care. We also, by AHS, were provided access to the knowledge management services team, and they helped us complete a comprehensive rapid evidence review to also help us identify the apparent gap in current patient and provider communication measurement tools to focus the project further. We then started meeting with and looking at all the different groups that might be doing work in the area of patient communication and patient and provider communication. We met with the Health Quality Council of Alberta, with the internal to Alberta Health Services Patient Engagement and Experience team. And we also met with Dr. Ward Flemons of the Greg's Wings Project, which was a powerful patient advocacy group dealing with trying to help healthcare teams to avoid those gaps in communication that lead to really tragic and sometimes loss. So if you have a chance and haven't heard Greg's story, please go check it out. And thanks, Chelsea, for putting that in. So finally, as a team, there were 4 of us at this point, another 2 PaCER graduates, Karen Moffat and Nancy Verdon, and myself. We also had 2 other patient partners join us later. And we did finally figure out what we wanted to offer to the medicine SCN in terms of a potential project. What we decided is that we wanted to explore patients with chronic conditions and their providers and what was happening at the healthcare visit in terms of communication. So we kind of got the impression from the data and the evidence that there was a need for some couples therapy for patients and providers, and not just to develop tools to train up better patients. We were all pretty adamant that we were tired of the whole idea of let's just train better patients and putting it all on them. We wanted to see if we could both learn about what was happening on both sides of the conversation, and if an intervention was required, it would need to address, again, both sides of the conversation. First step for us was we needed a way to measure what the current state was of patient and provider competencies, or how they were doing, how they assessed themselves as communicators in those visits with their patient, or the patient with their provider. So we went looking for a tool. We thought, well, there has to be a tool. Well, there wasn't a tool. There were some sort of tools that gave us an idea of what things were important in terms of patient communication with a provider, but none of them were specific to healthcare. They were mostly sort of psychology related tools. And so we decided to take on the task of writing our own survey. So we wrote a survey that we're hoping to get our results from here pretty quickly. We wrote a separate survey targeting our providers and in language that would be friendly to them, and one for patients. So again, asking the patient or the provider to examine their own role in the communication and assess their competencies. Our next phase of the project, after we've delivered this survey, which went out in February and we've closed now, but once we've got the themes from that, thanks, Ingrid, I keep forgetting to say next slide, is that we are going to also then go back to our PaCER methodology and host those all important focus groups. So by now our project had developed a new name. We've moved from patients actively partnering in their care to include our providers, and came up with a new name for the project, and of course an acronym, because you have to have an acronym, right? So we are patients. Our project is now entitled PEP Talks, or Patients Effectively Partnering with Providers Toward Active Listening, Kinship, and Safety. So we presented this project in June of 2022 to the Medicine SCN Core Committee, and it was approved to be pursued as one of the the research projects going forward out of that initiative. That came with a little bit of resources, including access again to some internal to Alberta Health Services specialists in both delivering surveys, but also in the data analysis and capturing and managing that. So really grateful again to the tremendous support we got from Alberta Health Services. We also began at this point seeking both an academic sponsor for the work and also providers to join our solid patient partner team who'd been working together for, I think at this point, almost 2 years. Unfortunately, as the world was in quite a bit of disarray at this time due to pandemics and other issues impacting our healthcare system in Alberta, we weren't able to get providers to join the formal sort of working group part of the standing up this research project. But we did get an academic sponsor in Dr. Anna Purdy, who is the actual scientific director of these strategic clinical networks that we keep talking about. And she's a well-published researcher, and again, based out of the University of Calgary. So we stood up our working group, which is how AHS kind of approaches research projects from within the strategic clinical networks. And we started working on developing our protocol with the aim to then put it in front of the ethics review board, similar to what we did in our PaCER process. We definitely used all of our PaCER skills as a team. They became foundational to the study design. And although we were adding a component that PaCER didn't teach us a lot about, which was survey development, survey tools and analysis of surveys, AHS gladly gave us access to the health systems knowledge evaluation team. And they've been so wonderful to work with and really treat us as peers and are teaching us lots about all the different ways of analyzing survey data. We submitted our protocol in late 2023 to the University of Calgary Ethics Board, and we got our approval in January 24. We got our survey up and loaded into something called RedCap, which is a platform that lots of the surveys are loaded onto. And our survey closed at the end of March 2024. And right now we are just waiting on some of those initial data pulls that this fabulous team, Health Systems Knowledge Evaluation team, we work together with them on a data analysis plan. And so they're going to give us a report on that. And then we will review the themes that come out of that survey. We had great uptake on the survey. I think it further impressed them that a group of 4 patient partners, myself as the lead and the 4 or 5 others, we had some of the best numbers they've ever seen for uptake on a survey. We used the snowballing method. We were hamstringed in that we couldn't go sort of out to like organizations like the Kidney Foundation or other chronic disease groups to try and use their social media and stuff. They wanted us to use our own personal contacts, but we, after 48 hours, they were like, we've never seen uptake on a survey like this. This is incredible. And it also worked with our providers, which is always a struggle to get providers to answer surveys. But we did get definitely a representative sample, pretty good uptake. Not quite as good as the patients, but the power of a good patient partner and patient partner team was definitely evidenced. And they wanted to know what we did because they actually, as a team, deliver surveys all the time. It's like, oh my God, how did you do this? So yeah, that's been my journey and evolution so far as from a patient myself, and then a patient advisor with this deep passion for healthcare safety and for patient engagement going forward. Thanks for letting me share.
Thank you, Sherry. And so we'd like to welcome Esther's story as well. And I just need to give a bit of background, and that is, I met Esther maybe 4 years ago, and she had an idea for a project, and it was so exciting for me to recently become aware of how far she's come with this. So Esther has not taken the PaCER program. I'll let her tell her own story, but she has been incredibly resourceful and unique in the ways that she's continued with her desire to work on this project and the way it's evolved. So I'm going to turn it over to Esther now.
Yeah, so thank you very much, Ingrid, for inviting me and all the thoughts that you also helped to put into this, in cooking it to this point. So I'll just get on. So my name is Esther, and I'm co-leading a project as a patient partner on a project that was recently sponsored by SPORE, Evidence Alliance. The project is about detecting human trafficking in the clinical setting. And in my professional life, I'm a grants facilitator at the University of Lethbridge. So I just wanted to say a few things about SPORE Evidence Alliance, because I think it's important the way they are set up, the alliance that bring together most of the stakeholders within the Canadian health system, the people like us in the community, the providers, the administrators, and all of that, bringing them together to see what's priority, to fund, to look into, to research. So it's a good thing to just speak about them, because I have benefited from what they do. And the funds that they provide is from the Canadian Institute of Health Research and other 41 partners, which are in the public and not-for-profit organizations across Canada. So for their competitions, it starts by requesting that public or people in the community like me send in topics of interest. So in the 2023 competition, I submitted. So I will finally talk about my journey, but I just wanted to introduce how I got to this point in terms of funding and getting ready for research. And so I submitted a topic of interest, which is about human trafficking in the 2023 competition. There were 87 topics submitted, and 20 were selected based on the following criteria. On impact, how they evaluated if each topic, how it connects to the clinical, economic, and population effects and all of that. They also looked at the unmet needs and evidence gap in the health system. They assessed the extent to which each of the topics we submitted would fill in those gaps. Then they looked at the uniqueness. They considered each topic based on the current health system landscape to avoid duplications of effort in research and knowledge building. And they also were looking at the timeliness of that topic as it fits into what's in the strategy for the health system currently. So they looked at project for emphasis on the current health system landscape, and they prioritized topics that addressed urgent needs. So that's how they actually selected the topics. And we did have an interview also to talk to them about the topics, talk to them about our interests, why we're interested in it, and so on and so forth. So successful projects were matched to PIs eventually. So these are the two PIs that I'm working with right now, and we're just starting out. So Doctors Flores and Velez, they are interested in the project. So I just also wanted to touch base about what's the problem I'm looking at and why I'm looking at it. Human trafficking is what I'm looking at. It involves the recruitment, transportation, and harboring of persons for the purpose of exploitation, generally sexual exploitation or forced labor. It is believed to be one of the fastest growing crimes globally, with about 24 to 40 million people forced to carry out dangerous and dehumanizing work. In Canada, it is considered a criminal offense, whether it occurs entirely within Canada or outside the borders. And my interest, actually, I should say, is because it's highly gendered, affecting mostly women and girls. Trafficking for the purpose of sexual exploitation appears to be more prevalent in Canada, and it has been strongly linked to the high rate of violence with women, Indigenous women particularly. And as you will see the statistics here, 95%, so these statistics are police reported, and that's the focus of my research. So what we know is what the police is reporting, and you can see all of that. So, but we know that trafficking affects many aspects of health, and victims will go into the health system at some point because they are impacted by what they do, the dehumanizing things that happen to them and all those things that happen to them. So why are we not identifying or able to identify within the health system? So that was my question. So, and for this project, one of the things that we were trying to look at, or were trying to see as an outcome of this, is to have a tangible tool that can help physicians to interact or to detect or even to intervene. You know, sometimes it depends on how ready the victims are in terms of intervention, but at least there's something useful for intervention. So that's where we're going with this project. Right now, we're starting out with a systematic review. So now I talk about my journey. So as I'm not a person with lived experience on this, but my community engagements and interactions with my community, I used to live in Edmonton, suggested to me, or I began to see elements of this within the community as I interacted with the community-based outreaches that I, volunteered for. Although at this point, I wasn't quite clear that I was seeing human trafficking. I didn't know what that was. I didn't know the definition. I just thought what I was seeing wasn't right. And is there any intervention? Who is helping? What resources are in the community? What's the government's approach or strategy to deal with this? So I was thinking all these things as I began to pick up little bits of this here and there. So I began to gather information to know. So after the idea came, it wasn't a research idea, I should say. It was more of an interest to see something being done to help. But as I began to gather information, I realized that it will be a research idea because there is not much on this issue. So I thought, well, we should be researching into this. Who is doing what, where things are, and all of that. So I began to gather information. First of all, I was listening to stakeholders. I should mention here that I followed a few victims or survivors, like testimonies and reports and all of that. I began to listen into that. Then I reached out to intervention groups, support groups who intervene. Sometimes it's good to also see that side of things, how they view the issue, the problem. So I interacted with them. I went to information sessions on it, where even parents of victims were speaking on how it impacts them. So I was, engaging in that way, collecting information. Then along the line also, I was looking at the literature. What's the incidence? What's the government reporting strategy of the government, directions on this? Because I now realized after looking at the literature that it was a huge problem. But we are just beginning to put in strategies to deal with it. So it was a good timing for us to start researching, putting information together on this. So then I went into the academic literature too, because my background is actually basic sciences, clinical research background, but I was mostly doing cancer benchside research. So I began to look at the academic literature. So what I found was that there was limited information in terms of the nature, prevalence, scope of that. And especially, I realized that the Canadian literature was actually lagging behind compared to the American literature. So I picked up on that too. So following the information gathering, I actually came up with a draft outline and of what the next steps on research could be. And that's when I started thinking, so who is the researcher who will be interested in this? So I reached out to Alberta Sports Support Unit, and that will be Ingrid, who I actually chatted with many times by email, we had dialogues here and there on, on stakeholders engagement finding PIs, finding funding, and even subject matter resources. She began to gather them. I remember one of the emails was as long as this, so I just was going through them. Anyway, so again, I was also cold calling to PIs. I will look at their sites and see, are they doing anything related to this? But many of the mainstream PIs were cut out to what they were doing. They were focused on things, and many were not interested in picking this up. So I'm grateful that this was picked up through the SPOR funding. So I will say from all of this, I learned resilience, that if you have something in mind, go for it, especially because it's not for you actually. I would imagine that people who are in this problem aren't even thinking on how, what's intervention and all of that, how to progress in terms of finding resources. So I think it's always good if we have something in mind to just keep on with it. So that's the journey until 2023. So I had a refined proposal through our Better Sport Support Unit. I continue to refine it until the time of the call out for the competition that I submitted. Then again, the Sport Evidence Alliance, we were able to get interested PIs funding, and the proposal was also refined through the interview they had with me. Of course, I had this whole thing I wanted to do, but we had to cut it into pieces of what was feasible, a step at a time. So, well, that's my story up till now. And yeah, I'll leave it here. We have questions.
Thank you, Esther. And I'd really like to leave time for questions and answers. And as well, we'll put everybody's email in the chat, and you're welcome to follow up with us after this session if you have questions for any of the patient research partners or myself. I'll just quickly wanted to share that you are not alone. So you've heard from these 4 different patient research partners, their tenacity, their dreams, their vision, the different steps that they took to sort of help make their journey happen. So just letting you know that there are many free webinars and workshops out there. There's sponsorship, patient partner sponsorship to attend conferences, podcasts and journal clubs. The PaCER program, I didn't want this to be about evangelizing PaCER. There are lots of different ways to gain research skills as well. And also Google Scholar is great. You've heard about a few publications, so please feel free to go onto Google Scholar and put in some keyword searches and just see what comes up. As well, the different SPOR support units. So at the SPOR support unit site on CIHR, there are actually hyperlinks to each of the SPOR support units, and I strongly would encourage you to reach out, even if it's not the province or territory you're living in. All the websites have great resources, information about their upcoming webinars. They also have these online connection sites where you can learn about patient partnership opportunities. As well, the different website SPOR units, different chronic disease networks have small modules, learning modules, learning webinars. Also, if you aren't on Twitter, many opportunities become shared on Twitter. So joining the SPOR support unit's Twitter site, patient organization Twitter site, or even just following them as a non-Twitter member, you might learn about different research opportunities and training opportunities. Also, local colleges and universities, you might be surprised. Especially if you're a mature student, you might be able to take a couple of qualitative research courses or evaluation courses. So encourage you to check that as well. And Sandra Zielinski, a PaCER graduate as well, has created for ABS4U a series of patient engagement podcasts. There are many other patient engagement podcast series out there as well. So, so that's another way of learning more. We also have our ABS4U Journal Club. And I'm not going to talk about compensation, but compensation is definitely a topic. And just to be really clear that compensation is different from reimbursement. There's a couple of links here to some compensation guidelines. Each SPOR support unit has their own compensation rates. and guidelines. So, so again, please reach out to your support unit if you need help receiving compensation for the work that you're doing. So in conclusion, the patient researcher role is ongoing. There's no endpoint, and your research journey should be living. It should be ongoing. There's need to be open-minded, adaptable, flexible, tenacious, comfortable with ambiguity and delays, absolutely. And as these 4 research partners have shared, you know, it's important to choose and sometimes create the role and the spaces you'd like to have for yourself in your journey. So I'm gonna stop sharing and see if there's any questions.
Thank you all for sharing your stories and for such a wonderful presentation. I feel like we need like a second part to have a panel discussion now after that. We've got about 2 minutes if anyone has a quick question, and if everyone's okay on the line, I'll add everyone's emails into the chat now, if that's okay. Anyone online? Holly, I see your hand up. I'll see if I can get you to unmute there. That work?
Can you hear me? No?
Yes. Yeah.
Oh, good. Okay, great. So everyone, thank you so much. That was really fascinating. And I totally agree. We need a half an hour now at least just to debrief and chat some stuff through. I really appreciated hearing all of that. Mine is maybe a quick comment, but I'd like for you to confirm if I'm right in what I'm thinking. So as many of you were talking, and even Ingrid right from the beginning, because I've always been curious about the institutional support required to make a program like PaCER work, or institutional barriers to patient-led research. It seems to me that without the support of the University of Alberta, Alberta Health Services, maybe the strategic clinical networks as well, it makes me think, well, who developed the curriculum for PaCER? Who teaches it? Are there any faculty members involved? Who hosts it? Oh, it's the University of Alberta, right? So am I right in thinking that that kind of institutional support really is a facilitator of this kind of work? Because I feel strongly it is. And I think that as I was listening to some of you talk, I was thinking again, oh, well, without Alberta Health Services really being behind that, I wonder if that project would have progressed as well as it did, et cetera. So does that make sense what I'm getting at? Because when I think about here at MUN, and this is not to diss my own university, but right now, a patient partner cannot be a principal investigator here on a grant out of Memorial University. It's that simple. They don't have the responsibility of submitting the grant, creating all the attachments, running the budget, filling out all the reports, blah, 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 blah. So it's an institutional barrier sort of thing. So is that true, guys? Like, am I reading that correctly, that institutional support, whether it be the university, the health network, et cetera, really is a critical thing, that kind of buy-in?
I would agree, except I think, so for PaCER program, Dr. Maria Santana is the PI for most of the projects to get the RE approval. If there are other sponsors, if the sponsor is a PI themselves, then they can get the institutional approval. And so for Esther's project with the For Evidence Alliance, they also have a PI. But I think what we were trying to show with this presentation is that really the projects themselves are still patient-led, patient-driven, patient-inspired. So despite that little technicality, really, there's that expression that if you make up your mind, you know, the money will follow, the support will follow. And I think that's what we were really hoping to show, is that, you know, maybe one day that will change. But in the meantime, you know, I think that the inspiration and the tenacity and the rigor and the brilliance with which these patient partners have developed their ideas, developed their thinking, has really attracted the PIs to them as well.
Yeah, fabulous. So, no, that's fabulous, Ingrid. No, that's great. But that kind of concurs with what I was thinking. Yeah, no, I think it's fabulous. Really great work. Loved hearing about it.
I see that we're 1 minute over time, and like Holly, I'd love to know more, because of course in Newfoundland, we're also always trying to look at ways that we can increase capacity for these kinds of projects. So you'll be getting an email from me, definitely, all of you, to continue the conversation. And thank you for agreeing to share your emails. If anybody does have any follow-up questions for any of our panelists here today, you are welcome to email me or email any one of them. and we'll make sure that that question gets to the right person. We'll also follow up with an email. Ingrid, if you're willing to share your slides, we can do that. And of course, this will be recorded, or has been recorded, and will be posted eventually on most likely our YouTube channel, as well as the Alberta Sport Support Unit's social media channels as well. So thank you all for presenting and sharing your stories, and thank you to our attendees. And if anyone has anything else to say it now, because otherwise I'm going to let you all go since we're 2 minutes over time here. Okay. Thank you, everyone. Have a wonderful rest of your day.